So we have very effective drugs that kill tumor cells, and they kill tumor cells faster than other cells in our body, but our other cells are also influenced negatively by these drugs. Inevitably?
It's hard to escape for one simple reason, which is that cancer cells are human cells. So if we use something that's designed to kill a specific set of human cells, it's likely to be toxic to other human cells as well. This is a problem we don't face with infectious disease, but we do face with cancer.
So using multiple drugs, you're going to get multiple benefits killing off cancer cells multiple different ways, but what about the side effects and the dangers to our other normal cells?
Right. The combination that makes a drug more lethal to the cancer also makes it more toxic to the patient. So in practice, we've seen that these combinations or cocktails are very good at shrinking a tumor, but they're less good at keeping the patient alive because they become more toxic to the patient.
So are there certain combinations of drugs that double or triple or quadruple the toxicity, and there are some combinations that just are kind of additive in terms of the toxicity?
That question is exactly one that's getting a lot of focus right now in cancer medicine. It's a big problem because there's a combinatorial explosion, if you will. If you have a lot of different drugs to try, you have a lot more different combinations to try, and it's hard to try them all in clinical trials that have enough patients. It takes a long time.
I talked to some cancer experts recently who said that for the kind of cancer that they treat, they have 30 different drugs, and they don't really have any theory about which drugs to use. It's just pure try things and see which ones work and try a different combination. Do you think we can get beyond that pure empirical, try it and see what works, and use some kind of theory to guide which combinations will be best?
I think it's possible to do better, and we need to do better.
Mm-hmm. So you've worked with complex systems as well. How is that relevant to understanding and treating cancer?
Well, what science has done in the past is to take some system we want to understand, disassemble it, understand the building blocks, and
so break it down to its tiniest parts.
Yeah, break it down to small parts, and break this down to smaller parts. And once you've broken it down as far as you can go, and you understand everything about the smallest parts, you might feel like you totally understand this system. However, it turns out there may be things about the original system we need to understand that we still don't understand even after we've finished.
Because our parts interacting with each other?
Because the interactions are important, right.
So can mathematical models or computer models help us understand that better?
They can, yes. If we want to understand interactions, we may not be able to there's two conflicting pressures. We need to make things manageable in a laboratory. We have to reduce complexity,
right,
the complex interactions. But if the complex interactions are what we need to understand, we're stuck. One way around this is computer models where we can, if we understand the subparts, we can represent them accurately in a computer simulation, put them together, and create a simulated world where they interact in ways like the real world. Mm-hmm. So we've got the parts, we've got their interactions, and because it's happening inside our computer, there's no limit on our ability to observe. We can observe everything, measure everything. All the subunits in the system can be classified, measured completely, and all their interactions also get recorded. So we get to see everything, and we can build and test hypotheses in these models.
Okay.
Next step, of course, is asking, does what we see in our model really happen in the real world? That's the next step.
That's a good one. Yeah.